Our first podcast. My name is Cindy Zhang, and I'm a doctor of physical therapy. And today we have here as our guest Dr. Lyster. She's a hormone expert. So welcome, Dr. Lyster.
Thank you so much.
Yeah.
Thank you.
So tell me about a little bit about yourself and how did you first start your business?
Well, my background is as an OBGYN. I am a board certified OBGYN doctor. I stopped OB a long time ago, really somewhere around 10 years ago, because I prefer to sleep at night.
Yeah.
And babies don't really care about that. And so I became really an expert in women's health, developing a specialty in menopause, hormones, and weight loss.
Mm-hmm.
Over time, my practice started to really focus on that.
Mm-hmm.
And about 6 years ago or so, I pursued additional training. And so now I can do hormone balance work for men as well as women, and really of all ages.
Oh, wow. That's incredible.
Yes. It's very satisfying. It's a lot of fun. I enjoy it a lot.
That's great. I believe you're how from the start of being an OBGYN to now being a hormone expert, how did you find your avatar, like people that you want to target with?
That really developed itself. And I will also say that I chose OBGYN, my specialty, because I saw the difference that talking makes to women.
Mm-hmm.
We love to talk. We just do. It's a fact.
Mm-hmm.
And we gain a lot of benefit from that. So it combined a lot of the things that I enjoyed doing. However, over time, I really have now evolved my practice into a consultation practice where that is what I do, is talking with people, finding out what is their, what are their passions, what are their interests, and what do they not have physically that they need to have in order to be out in the world living the life of their dreams and having families and relationships that they wish to have. Mm-hmm. My ideal patient is a woman in somewhere in the middle of her life, usually. She has symptoms going on that a lot of times, unfortunately, in our medical system, such as we have it in the United States right now, is aimed at just treating symptoms. Mm-hmm. And my patients don't want Band-Aids. Mm-hmm. They want to get to the underlying root cause. Mm-hmm. They want safe, natural, effective treatments for those issues. And hormone balance achieves that. Mm-hmm. The men that I take care of are also awesome. And a lot of times, hormone balancing can help men, as well as women, of course, regain energy, help them lose weight, help their metabolism work correctly. And again, by getting at the root cause and not just doing a diet or giving a pill to just treat a symptom.
Yeah, that is so true. As a physical therapist myself, that's all we look for. We want people to understand what is the root of their problem. And when we find out what it is, then we can treat whatever they have. And so I really love it. I really love that that's what you do. And what you do is so much aligned with what we do too. Yeah. So how... since you are seeing patients for so many years already, can you give me some advice in like how you put the patients first? Because right now in medical field, everything is not really gearing towards patients, but I think we're moving towards that. And probably in 2010 or coming up in the future, it's more and more patients first, right? So how do you put that into your practice?
My practice is definitely patient focused, no question about it, and really patient driven as well. And the way I describe what you were just talking about is the tail wagging the dog. Patients want control over their treatments. They want to understand. That's why people look things up on Google. They oftentimes don't have doctors who will sit and take the time to explain, and not just the symptoms and the causes, but the treatments as well.
Mm-hmm.
In my practice, I don't bill insurance. I do provide patients with everything they need to submit to their insurance. However, usually by the time they've gotten to me, they've looked other places. They've gone to their regular doctors, their conventional medical people, and not gotten the help that they need. And so by the time they're coming to me, they're ready to invest in themselves to get what they need, have safe, effective treatments for the imbalances that are happening in their body so that they can feel great and feel like themselves again.
Wow, that's awesome. Because right now, actually, I'm going towards that, and I want to just focus on patients first, and I want to like help people that are around, like women especially, right? Just like you. So I really love your passion in helping women, and especially hormone balance. I think not a lot of doctors really just take their time and look into what is causing them this way, right?
Exactly.
Yeah, that's awesome. So I know that right now you probably like have a full schedule, right, of patients and family also, because you're a wife yourself. So how do you balance with work and life?
I have to always practice what I preach. I have to.
Yeah.
That's part of my credibility, is that I have to do myself what I want other people to do and what I want other women to do. I believe, generally speaking, we as women put ourselves a little bit lower on the to-do list, right? And so that's really my answer to your question, is I just put my own things that I need to do for myself on my priority list. And I have to take care of myself. I have to eat well. I have to exercise. I have to keep my hormones balanced. I just have to do those things. And it's just a matter of a functional task management. You know, it's not magic.
Yeah. That's so true. And we're all probably working on that.
All the time. It's a work in progress all the time.
Yes, absolutely. I agree. Wow, that's awesome. So like you said, do you work out every day?
Definitely not. I don't work out every day. I am a big advocate of you do what you can in this life. That's one of my phrases. You do what you can in this life. And I try to do a workout which is a little more formatted, maybe twice a week if I can. I go dancing. I am passionate about Argentine tango dancing.
Oh, wow. Okay.
And my husband and I take lessons, and it's a lot of fun. And my family's from South America. My family is from Argentina, so we enjoy that.
Wow.
So different ways, and I talk about this with my patients as well, different ways of moving your body. It's not about slogging it out at the gym. A lot of people are understanding more and more, for example, for weight, managing our weight or losing weight. It's not a calorie in, calorie out. And people have to avoid injuries.
Yes, definitely.
Right?
Yes.
So it's not about going from 0 to 100 miles per hour. It's important we do what we can, and also to keep moving, right? The non-exercise, that's parking further away, taking the stairs, all the stuff that we all know. But most of the time I see people setting themselves too high of a standard. I'm going to go to the gym every day. You're not, because something will happen and you'll miss a day. And then what most people do is beat themselves up rather than what can I do that will be a step in the right direction for me? Yeah,
that's perfect. That's perfect. As a physical therapist, even though I do suggest people to do exercise every single day, but it's not really possible. Myself, for example, I only work out like 3 times a week, and I do it at home when I can, and it's just half an hour workout. So it's not everybody can do it, right? Everybody
That's
can
right.
take half an hour of their time and just exercise, right?
Yes.
Yes.
And the baseline activity level is important too. So going out for walks, especially walking after dinner.
Yeah.
That has a really beneficial effect. Moving the large muscle groups before you go to sleep at night when your body's doing a lot of hormonal balancing work while you sleep.
Okay.
Oh, and by the way, getting enough sleep
Oh,
is important. I talk
Yeah.
about that.
Okay, that's awesome.
Yeah, absolutely.
Yeah. So how do you stay fit and healthy? So like you said, eating healthy, right? And then exercise. Anything else that you want to teach us about hormone therapy or from your expertise to stay healthy and fit?
Yes, I like to emphasize variety.
Mm-hmm.
So I talked about for myself, sometimes it's at the gym, sometimes I can go swimming, sometimes it's an aerobics class, other times it'll be yoga, other types of exercise that promote circulation. So you're not necessarily doing 100 jumping jacks or 100 sit-ups, but you're moving your body in different ways that builds different muscle groups, right, as in your expertise.
Yeah.
So that's I like to emphasize the variety. I definitely go by that myself.
That's awesome. That's awesome. So just like recently, I've had somebody, even my cousin, she does a lot of yoga. And but I tell her, don't overstretch, right? You cannot always just do yoga and just focus on that. You have to do some strength training or build up some muscle strength. Yeah, so I totally agree what you're saying. And so what do you feel about women in business? Is it hard? And like from the start, I like so many years of experience, you probably can teach us how did it change from the beginning to now and being a woman in business?
That is a really interesting question. And for myself, I am really grateful to have my own business because of the freedom that it affords me in terms of my schedule. I've had jobs which were great. I've worked in all different scenarios. I've had hospital-based work, clinic-based work. I've really had a lot of different environments. Big clinic. I've also worked in a very small practice. So I've been in a lot of different environments, and I've had my own practice before, but I billed insurance at the time, and the way the insurance setup is right now, it's a mess. And it just didn't work. I just literally couldn't keep my doors open. So that was a while ago, and I'm excited to be doing this again for the last 2 years.
Wow,
since 2015. And it's great. It's not a skill set. Running a business is not what makes us be healers.
Yes.
They're different skill sets. So I have gotten pretty good at asking for help in general, which when we're a strong entrepreneurial type of woman, we're not necessarily great at asking for help and allowing other people to help. So that's an important tip for your audience.
Yes.
So I've developed that skill, and it's still important. It's important to be organized and to be able to deliver care to people the way I want to on my own terms. That's exciting. That makes it worth it.
That's awesome. That's so encouraging for people like us that is starting out and just having that perspective that it's okay. Like not following insurance is okay because patients, as long as we provide the best patient care, people will need us, right? Yeah.
Exactly.
Perfect. So what's your vision for your business and yourself in 5 years, and how do you see yourself changing in 5 years?
I'm also this is a good time for me to also say that you were looking at my book a little while ago. My first book that I've written is called Dr. Liz's Easy Guide to Menopause: 5 Simple Steps to Balance Your Hormones and Feel Like Yourself Again. And I purposely meant for this to be a small, easy to read book. And that way, because the women I take care of are busy.
Mm-hmm. Yeah.
They don't have time to read a giant textbook.
Mm-hmm.
They may like that, which is great. There's lots of those out there. But mine is really a short, easy guide. And people can find out more about that on my website, drlizmd.com, drlizmd.com.
Perfect.
Lots of information there.
Mm-hmm.
So that's where I see myself going is I love being in the office with patients, and I love helping individual people feel better. And over the next 5 years, I'll be getting out speaking more. Hopefully, more people will learn about the fact that they don't have to tolerate not feeling great.
Mm-hmm. Yes.
That's my
so
message, that
mm-hmm.
I am just passionate. I feel sad about all the people out there who are cranky, tired, and they think they have to be that way.
Mm-hmm.
They don't know there's another way.
That's so good.
Yeah, exciting.
Yeah. So just like Dr. Liz said, that we don't have to settle. Like, just same as physical therapy. If you ever have pain, you don't have to settle. You should get treatment early as possible, right? We don't want to be a chronic symptom, and then we're treating something chronic that's going to take longer time, much more money, right?
Absolutely.
Mm-hmm.
Absolutely. There was a study that showed that people spend several $1,000s within the regular medical system without feeling better.
Wow.
Because they just keep getting different Band-Aids applied. And people aren't coordinating with each other. They're not looking at the underlying causes. So that's absolutely right. People can invest in themselves at the outset and get feeling better quickly so they can get back to their lives just they want.
Yeah, exactly. So last but not least, my question to you is, what advice would you give for somebody that's starting out, maybe with their business or their career, or just in the patient perspective? What advice do you give for people to actually feel better and just like normal day to day? Any advice for them?
Yes. Couple of things. One is, we've all been on airplanes. Most of us who are watching this have probably been on an airplane before. And they tell you that there's an emergency, put your own oxygen mask on first. That is one of my favorite pieces of advice, is to remember that. Another piece of advice that I was just recently given, and it's really magical, really, really helpful, is to keep in mind, at the top of your mind, who it is that you want to serve. This is more from the business side. Who it is that you want to serve, who you want to take care of, and do everything consistent with what that person wants and needs. Then you won't get caught up in, I should go take that class or do that workshop. If it doesn't directly help the person you're most passionate about serving and helping, then you can just say, no, thank you.
Wow, that's awesome.
It is a wonderful, wonderful piece of advice. And again, I just want people to remember that if you don't have your own health, then what do you have? And what can you give to others?
Yes, I totally agree. And as someone that's starting out, we're losing focus. We don't know where we are going. And finding our avatar is so important, because then we can serve them better. Thank you so much, Dr. Liz. And it was wonderful having you here. And I hope to maybe in the near future, we'll be collaborating things together and working together.
That'll be great. I look forward to that.
Thank you so much.
Thank you very much.